Hello and welcome to Rooted in Research. We are so glad to have you with us today. My name is Sang Choi, pharmacist and research scientist for the Office of Cannabis Management, and I'm really delighted to be your moderator for today's webinar. Rooted in Research is a space where evidence, expertise, and real-world experience come together. We spotlight the latest science, policy developments, and clinical insights shaping the future of cannabis. And we create room for researchers, practitioners, patients, and public, and policymakers to connect, ask questions, and learn from one another. We're joined today by two outstanding researchers whose work is advancing the science and understanding of cannabis in healthcare. We have Dr. Renessa Williams, who is a registered psychiatric nurse and tenure-track assistant professor in the School of Nursing and Health Studies at the University of Miami. She is an HIV health disparity scientist whose NIH-funded research examines how stigma, structural inequities, and substance use, particularly cannabis, affect immune function, inflammation, and long-term health outcomes among people living with HIV. Through her ongoing study, Cannabis Use and Proximal Immune Dysregulation, CUPID, Dr. Williams is advancing precision health frameworks to better understand both the therapeutic potential and risks of cannabis use in HIV care. She also serves as a board director for the American Cannabis Nurses Association and co-founded the National Cannabis Nurse Task Force, uniting nursing professionals to strengthen cannabis research, education, and harm reduction practices nationwide. Dr. Denise Vidot is a tenured associate professor and NIH-funded epidemiologist at the University of Miami. She's the founding director of the Global Cannabis and Psychedelics Research Collaboratory and director of community and stakeholder engagement at the university's Clinical Translational Science Institute. Dr. Vidot serves as principal investigator for multiple NIH-funded studies, including the Herbal Heart Study, the first NHLBI-funded cohort investigating the relationship between biologically quantified cannabinoids and early cardiovascular disease. Her research bridges epidemiology, translational science, and digital health to inform evidence-based cannabis policy and clinical practice. She's also building one of the first nurse-led cannabis research infrastructures and AI-driven harm reduction toolkits in the US and the West Indies, driving innovation in equitable and culturally responsive cannabis care. Before we get started, I will read a disclaimer before today's programming. The Office of Cannabis Management makes no claims, promises, or guarantees about the accuracy, completeness, or adequacy of the content of this video live stream event, and expressly disclaims any and all liability of the content and for errors or omissions in the content of this video live stream event. This video live stream event is for informational purposes and convenience of the public only and does not constitute endorsement, recommendation, professional advice, or favoring by the Office of Cannabis Management. The content of this video live stream event is based on information available at the time of recording and is subject to change. So it is a great pleasure to welcome you both to Rooted in Research. We're excited to dive into your groundbreaking work and hear about National Cannabis Nurse Task Force and how it's advancing evidence-based cannabis clinical practice. So let's get started.
Hi, everyone. Thank you so much. My name is Dr. Renessa Williams, and I just want to also thank the New York State Office of Cannabis Management for having us. Just a little bit about me to start. I am a nurse scientist at the University of Miami School of Nursing and Health Studies. I'm the director of the iRise Lab and co-founder of the National Cannabis Nurse Task Force. And while my area of research largely focuses on the biological, psychological, and social effects of stigma as it relates to HIV and cannabis, my colleague, Dr. Vidot, brings critical insight from an epidemiological perspective, and I'm so grateful to share this space with her as we discuss with you all how nurses play a vital role in transforming cannabis clinical practice. So Dr. Vidot, please take it from here.
Hello, friends. Thank you so much for joining us today. I am Dr. Denise Christina Vidot. I am a cannabis epidemiologist here at the University of Miami. I know you just heard of our backgrounds, but I wanted to start off today a little extraordinary. It's Friday, it's the day of love, and we're also talking about cannabis. So if you can hear my voice or if you can read the captions on the screen, you have an endocannabinoid system. And what we're going to be talking about today is how we can balance that or work towards harm reduction in unbalancing your endocannabinoid system. So we can balance this with objects beyond cannabis, including our own breath. So if you can join me for a quick 30 seconds, I would like to invite you to take a deep breath in. We're going to breathe in for 2 counts. We're going to hold it at the top for a moment, and then we're going to release for 4 counts so that we can be here present, ready to learn about the National Cannabis Nurse Task Force. So please join me in a deep breath in for 2 counts. Hold it and release. One more time in case you missed it. This time, as you breathe it in, let's breathe in plant medicine, breathe in the sun for 2 counts, and release. I am ready to fly. Go ahead, Dr. Williams. Please take over.
All right. Great. So thank you so much, Dr. Vidal. So today we have several objectives we're planning to discuss. First, we want to talk about the development and structure of this collaborative research model. And then we're going to get into some data. We're going to talk about some qualitative data we looked at to explore the barriers and facilitators that shape cannabis nursing research and practice. Then we'll get into some preliminary survey findings from our national survey of patients and healthcare providers and nurses, and how we can use that to inform the perspectives of cannabis harm reduction and intervention specifically. And then we'll get into some priority recommendations to advance the field as a whole.
If you have questions throughout, please place it in the chat and we're happy to answer it throughout. And at the end, we have a section for that.
Yes, thank you. So I want to tell you all a little bit about my story. As I mentioned before, I'm the director of the Intersectional Research and Stigmatized Community Lab, what we call iRise for short. And stigma is the focal point of my lab for several reasons. During my PhD program, I was a full-time student and a full-time psychiatric registered nurse in a lockdown inpatient substance use unit, which if there's any students out there, I would never recommend you do that. But I did that. And during my time as a nurse, I noticed a lot of people I took care of felt like outcasts, not only because of the disease of addiction and the choices they made, but because of larger structural and institutional level factors, like not feeling heard by their doctors or their nurses or social workers. And on top of that, they may have lived in neighborhoods or been in environments that perpetuated harm because of who they were, their culture, their background, etc. So what they did when I did my nursing assessments and I would ask them about it, they talked about how they use substances to cope with that. And a lot of times that would be cannabis or something or another substance like alcohol or a mixture of something. So At the same time, I was beginning my dissertation work, which qualitatively looked at HIV specific stigma in Black women. And I would ask about 15 women, what does HIV specific stigma mean to you? And how does it affect your life? And across the board, these women would say something like, honey, HIV is not my problem. I'm worried about being a good mom. I want to teach my kids how to navigate this world that may keep them down because of who they are, their culture, their race, other geopolitical things. And they would often not be focused on navigating that themselves as women. So that was surprising to me. And it led me to think that maybe I need to look at the intersections of stigma beyond HIV. So flash forward 6 months to a year later, I started also working with the Florida Department of Health and their statewide data set of people living with HIV. And I wanted to see if and whether there were groups who experience HIV stigma the most. And that was surprising to me too, what I found. I found that those who experienced the most stigma were those who used alcohol and other substances, those who screen positively for depression, and those who were living with a disability of some sort. And I thought to myself, wow, these are communities who are heavily stigmatized, regardless if they have HIV or not. And based on the culmination of my experiences clinically and academically at this point, looking at HIV stigma and isolation for me was a great disservice to my work, and I needed to be thinking bigger. So then I went into my postdoc. I graduated, and I did my postdoc at the University of Miami, and that's when I did a mixed method study to qualitatively and quantitatively look at intersectional stigma in Black men who have sex with men who are also living with HIV. And one of the things that came up in this work was cannabis. And cannabis was used, these men described it as a medicine. They used it to cope with anxiety and the depressions of the discrimination they have faced and experienced. So I was always curious about cannabis and integrating it into my work, but I never thought I could study it as a science because I was discouraged, quite frankly, by my mentors at the time when I was a PhD student. But taking all these things together at this point in my life, I feel like cannabis was something that found me again and again and again. So in my postdoc, I just so happened to be connected, I think divinely, to Dr. Vidot. And she's a cannabis epidemiologist. She's going to tell you about her story, but she's been working in this field when I met her for, I think, 10 years or more at this point. And it blew my mind that someone could not only study this work as a science, but get this work funded not only by the university, but by the government. And ever since then, Dr. Vidot, for lack of a better words, we've been locked in. And so she encouraged me to pursue my own government funding for this work. And she taught me I can do it myself. So in 2023, I received almost $500,000 from the National Institute of Health to examine cannabis use and inflammation and cellular aging in people with HIV. And this study is so important to me because rarely does the government fund studies that examines the therapeutic use of cannabis. They mostly fund studies that look for evidence for the opposite. And hopefully that changes, but and I don't have findings to share with you all yet, but the science that's already out there looks so promising that cannabis is helpful in reducing inflammation via the endocannabinoid system, especially for those with HIV who already are predisposed to having these higher levels of inflammation. And what I can share with you, what we learned so far from the data is that about 80% of people in our sample of 600 men have used cannabis, and over 50% of those people have screened positively for cannabis use disorder. And what surprised me was a majority of our sample actually self-reported they want to reduce their use. So this was one of the many things that sparked our work together with the Cannabis Nurse Task Force to learn more about cannabis harm reduction and really leveraging the role of cannabis nurses. So well, I'll stop there. I've spoken about this from my lens as a nurse scientist, and Dr. Vidot has ran in this field so I could walk, and she has led this work in powerful ways. So I will pass it off to her now.
I'm so grateful for your words. I'm here trying to make sure I don't cry as I get to speak. So I appreciate that love. And I just want to everyone who's listening, I want to encourage you that if you have the idea in your mind, you can hold it in your hand. You wouldn't be given an idea if it wasn't possible. So please reach out to us if you are an emerging scientist or a cannabis nurse that's interested in cannabis research, and we're happy to help guide you or give you some resources. So with that, I just want to share briefly my perspective before we go deep into today's conversation. I was introduced to cannabis at a younger age by my family members in the sense that my father was diagnosed with multiple myeloma cancer while I was in high school. And at that time, I would smell something very interesting. And that would be the times that actually my father was engaged with us. I'm the eldest of 7 children. I have Puerto Rican roots. And I often talk about especially when we talk about cancer and cancer harm reduction and managing the symptoms that especially come along with chemotherapy. The cannabis has had such a stigma that even patients that are using it for legal reasons still are nervous to talk about it. And of course, when I started, this conversation was just a dream in my mind. I never imagined that I would be funded by the NIH to talk about cannabis, no less, or to be invited to talk here. And what's even more interesting is that my father was born and raised in Brooklyn, New York. So this conversation here in the great state of New York makes me very happy because it's a full circle moment. So my childhood and my upbringing, I always wanted to cure this multiple myeloma cancer of my father's. And he made me promise him that I would not become an oncologist and dedicate my life to curing multiple myeloma. But what he didn't say is I couldn't study cannabis. So I wound up by serendipity getting involved at Morehouse School of Medicine. I went to University of Georgia for my master's program. And I remember vividly that my mentor at the time started laughing hysterically when I mentioned talking about cannabis as medicine. Back then, I would use the word marijuana because I didn't know better about the importance of our words. And I also want to just drop a seed there for any of you who may be listening that the word marijuana is very charged. It has, words matter, and words are specifically created to entice energies. If you go back to the idea of spelling, we won't go there because that's not where we're here. But I just want to encourage you to think about calling it cannabis, especially when we're talking about it as medicine, because that is the name of the plant. So what I'm showing here is a screenshot of the highlights. I'm a very big football fan, and University of Miami was just in the championship game. And so these are the highlights when we think about these things. And when you see these logos, each of these logos represent a patient story or a community member story that I heard or I was either personally involved with. And we translated that into science. Because what I've learned very quickly throughout my training as a student, even as a PhD student, with all the laughter that comes along with the idea of cannabis as medicine, or the jokes about, oh, are you bringing brownies to the meetings? It's very sad that that's our reality, but I want to encourage you to stay strong and just politely always correct and be like, no, not brownies, maybe salad dressing though, because that's healthier. We want to reduce cardiovascular risk here. So speaking of cardiovascular risk, these studies here, the CanHeart, Cannabis Health and Fitness Study, Herbal Heart Study, all 3 of those are centered around healing our heart. My collaboratory is a global lab. We have research laboratories at the University of West Indies, which you can see here in this logo. I'm not sure if you can see my mouse, but if not, it's at the bottom next to the red circle. We also have research in collaboration in Egypt, in Italy, and throughout the United States. And what we're trying to do is get different perspectives of how cannabis and fungi, but we're not going to talk about that today, how cannabis is used by different cultures for different remedies. So this here is a way that I just want to encourage all of you also in the audience that when you think of research, we're not just thinking about patients in the hospital. We're thinking about citizen scientists, people who are growing it, who have been growing it, indigenous medicine, indigenous practices. But things are very different now. So that's why it's important for us to talk about what we're going to get into. And actually, Renessa, please feel free to go to the next slide. What we realize is that as we are working in all these different studies and communities together, we decided to create what I like to call a community of communities or a team of teams. And we work together as a co-laboratory. So often they talk about, oh, your lab, your research lab. I don't have a lab. I have a co-laboratory where multiple labs within our lab work together on the same goal. So here you could see some of our members. We were at a conference. Each one of those are students, except for the 3 in the front. So we have, of course, Dr. Williams, Teddy, who is here in the blue shirt, and then on the other side, Dr. Govine. The rest of them are trainees and ranging from undergraduate to postdoctoral fellows. And what I'm sharing here is that it's important to use your voice. It's important to share the medicine and the research and not just the idiosyncrasies that we know about cannabis. So with that, let's talk about why we are here and how we transformed our knowledge into something that's trustworthy and worth of conversation. So here I encourage you to scan the screen if you can, or if you're watching this later, please do save this. As mentioned in my biography, I am the director of community and stakeholder engagement at the University of Miami's Clinical Translational and Science Institute. And we work very closely with the AAMC, which is an organization that is working to promote justice, health justice in particular. And what you're going to scan and what you see here are what they call a trustworthiness toolkit. What we learned, especially during the pandemic, and I know that's a bad word, so we're not going to talk about that here, but what we learned is that trustworthiness did not exist. And not only did it not exist, it's very hard to maintain if it does exist. So before we even think about cannabis as research or cannabis as medicine, we need to first understand if we trust ourselves. So I encourage you, if you're interested in doing research, do you trust yourself? And then if you do, then start engaging with the community. And here are 10 steps that you can do that with and things to remember. And I just want to highlight one that is so important and why we created this task force. The number 1 here says the community is already educated. That's why it doesn't trust you. So when we come in as doctors, epidemiologists, nurses coming in, educating our community members, they're probably giving us a side eye because most likely they know more than us because of the lived experience. So what Dr. Williams and I did is that we took these tenets of the toolkit of the trustworthiness and we applied it to our already existing networks. So for example, you'll see the picture of how we created the task force, but we were building these relationships for years. And then something magical happened, and we can go to the next slide where Dr. Williams will take over and talk about what the American Academy of Nurses did. And here we go.
All right. Yes, thank you for keeping me on Dr. Vidot. So in 2023, something pivotal happened in the cannabis nursing world. The American Nurses Association deemed cannabis nursing as a specialty field, and that brought even more legitimacy to cannabis nurses. And the women that you see here on the screen are friends of Dr. Vidot's. They've been her friends for years. They've been doing cannabis practice and medicine for years, some of them decades. And basically, if you're not familiar with a cannabis nurse, these are nurses who educate, advise, coach, and support patients who use medical cannabis to manage various health conditions. And I'm sure all of us, or maybe some of us, have seen some news articles at some point that's shown vulnerable communities like older adults who may have consumed a lot of cannabis and ended up in the ER due to the overconsumption of it, which led to them having some kind of psychosis that needed to be managed. And our hypothesis is, and the data shows that maybe this is because of the fragmentation in care. This process of seeing a physician and obtaining a medical cannabis card, getting recommended to use cannabis, and then you just go to a dispensary to get a product. There's not much guidance in that process there. So we thought it was important to bring together this interdisciplinary group of not only cannabis nurses, but naturopaths. We have a physician on our team, an OBGYN. We have legal experts and lawyers and attorneys who our goal is to develop a cannabis harm reduction intervention so that this doesn't happen to anyone. We want to also gather evidence-based data to show that cannabis nurses can be an effective strategy or tool we can leverage to tackle these issues that our patients deal with due to this fragmentation in care. So the objectives of this group can be summarized in 3 ways. One, we want to generate data, evidence to explore the role and utility of cannabis nurses. Two, we want to integrate our members' experiences and knowledge to provide a context for our findings and interpret our findings. And lastly, we want to prioritize some actionable steps we can take and recommendations that, to policymakers to address some challenges that we have in this field. So we've been together with this group. Our group has formed, it's been a year and a half now, and we've just hit the ground running. We've been extremely successful, and we completed a focus group. That was one of the first things that we did amongst our cannabis nurse task force members. And what we wanted to identify were the barriers and facilitators of cannabis nursing research and practice and education. Because again, up until this point, if you look in the literature, there's not much evidence out there about cannabis nurses. What we see mostly is related to pharmacists and the amazing things they do. However, we wanted to hear the perspective of these providers. So our cannabis task force, our cannabis nurse task force comprises of nurses and naturopaths, nurse scientists, epidemiologists, a physician. There's about 8 of us from all over the United States, California, Florida, New York, and Colorado. And what we did, we met online via Zoom, and we just asked them questions about their day to day and the challenges they navigate. And we talked for about an hour and a half. And I wanted to share some key takeaways with you guys. There were 2 from our conversation, and we asked our members, what does that first session with your clients look like? What does it consist of? And across the board, they described the history of cannabis to their clients to first, what they called whet their appetites and get them interested. So this quote, the first quote here, I thought described a typical interaction, and this is from one of our OBGYNs. So she says, her clients say, they're like, "What? You mean cannabis was available in the pharmacies?" And she says, actually, they were called apothecaries back then. In the mid to late 1800s, they were the most widely used medications, substances for treatment of all sorts of things. They're like, wow, we had it and they took it away from us. Yeah, if you're not careful, they're going to take it away from you again. I think that's important. People need to know that. So that was very interesting to us. And another quote I wanted to share is from a cannabis nurse in our task force who was asked what makes this field so unique. So she described it here as, a dispensary agent in a licensed dispensary can talk to you about a strain and about the terpenes and that kind of education. Anybody can study that and learn it. What makes us special, cannabis nurses, what makes us that bridge is that we take our entire nursing background, our understanding of the endocannabinoid system, and then help you to take control of that and do something about it and support it and potentially, often, add phytocannabinoids to it. So a lot of the nurses agreed that despite the quote unquote name cannabis nursing, cannabis is not often their first line of defense for their clients and their ailments. It's not as simple as offering a client like a joint, which is what's expected. They take a holistic approach. So they want to learn about their clients. They want to get to know them, their health history, and try to engage the endocannabinoid system in other ways. So the first thing may be something like exercise or diet. I've heard of some cannabis nurses really using chocolate even to stimulate their endocannabinoid system. And oftentimes cannabis is added as a supplementary later on. So that was our focus group findings. And I also wanted to share some findings from our survey. We conducted a national survey to assess the barriers and facilitators of cannabis research and practice as well. We wanted quantitative data from the perspective of nurses and healthcare providers and patients. And if you take a look at the figures here, our preliminary findings here focus on nurses only, which included about 33 nurses, which we found they were mostly actively employed full time. More than half of our sample were registered nurses, and about a fourth were LPNs, and a fourth were advanced practice registered nurses. A lot of them have been practicing as a cannabis nurse for about 1 to 5 years, but really following behind that were nurses who've been practicing for about 5 to 10 years as well. Their primary role as a cannabis nurse were educators, and the setting they provided this education, majority mentioned other areas. And from what we learned, that could be like a telehealth online communication. It could be in libraries or other areas to meet patients where they are. They also provided education in traditional healthcare facilities or private practice, and a lot of our nurses were also psychiatric mental health nurses, or maybe in other areas, scientists as well, or midwives. And we have some more data to show you. Let's see. All right, and now we also looked at our full sample of nurses and providers. These were about 66 people who provided cannabis education in their clinical practice. And we found most people obtained cannabis education through online learning programs as part of their continuing education credits. And a little over a third of people agreed that specialist physicians should recommend cannabis for therapeutic purposes. However, it was pretty similar, a similar frequency. They agreed nurse practitioners as well as primary care physicians could potentially do this too in an ideal setting. The populations that our providers mainly worked with were patients with chronic pain. Well, following that, our providers mentioned, they work with the amalgamation of patients with qualifying medical cannabis conditions. The preferred model that our providers received cannabis education was part of an online learning program as part of continuing education credit. And a little less popular options were reading peer-reviewed articles or some other online resource. Some of the most pressing concerns in the cannabis nursing field, these were the top three. Our providers thought the treatment of pregnant and breastfeeding people who use cannabis needed to be revisited, as well as compensation for cannabis nurses. And the last thing was patient access and affordability of a medical cannabis card. The primary concern in the practice setting as a whole, however, was concerns that patients who request medical cannabis may want it for recreational purposes. There's also a lack of clinical guidelines for medical cannabis use, and they also mentioned there was a lack of knowledge or education or information regarding the use of cannabis for medical purposes. All right. So I know that we are coming up on time, but I wanted to thank everyone. And if you can take anything away from this presentation, I do hope that you have learned what a cannabis nurse is, that cannabis nurses can be used as tools to help educate, coach, or reduce harm in our patients. If we have piqued your interest and you'd like to learn more about what we do or even get connected with a cannabis nurse, please feel free to email us or scan this QR code here so we can get your information and we can reach out to you. Dr. Vidot, do you have any final recommendations or thoughts that you'd like to share?
Yes, I do. Thank you so much for sharing our results. Before we move into our question and answer section, I just wanted to highlight that the interdisciplinary approach is, I think, what makes us so unique. And I encourage you all to think about ways to do that. I think that Previously, a lot of silos were happening. The epidemiologists were together, and not sharing information. But now in this age that we're in, that's no longer acceptable or realistic. So I think this is a beautiful invitation to collaborate with your neighbors, collaborate with your colleagues, collaborate with industries that you never even imagined, because every single industry that exists can collaborate with cannabis as medicine, or cannabis and hemp as industrial. So this plant is so multi-purpose that I encourage you to think outside the box. This is the time to do that. The other thing I wanted to mention is that although Dr. Williams shared some of our results about the task force and some of the surveys that we've done so far, we're still accepting responses. We saw that as epidemiologists, we're of course used to working with populations of over hundreds, thousands, even tens of thousands of participants. So we are encouraging more voices in our survey, because the more voices that are included, the more precise, or the more opportunities for sub-interventions or programs to be created. A lot of the times, I have been recently moving more into policy, because in epidemiology, and this is going to be a quick Epi 101, there are steps to epidemiology. So we start off with our question, we get the data just by observing, then we actually do experiments, which are control trials. Then we use all that data to then inform policy if we're doing evidence-based policy work. And I think we are here in cannabis, and anyone who's listening, because that's why you would probably be listening. So if you are someone who's interested in cannabis as policy, or something in regards to plant medicine, fungal medicine, evidence is where it's at. And not only evidence, but being part of the studies that are collecting that evidence, so that it's not just one community that typically responds to surveys. So with that, I just want to share that we love you. Even if I've never seen you in real person, I am so grateful to share space with you all. And I thank you and look forward to collaborating in the future. Peace.
Well, thank you both so much for that wonderful presentation. I think it just highlights, the fact that there are many different levels of care that a patient or a person has access to. So thank you for sharing your, presentation with us today. So as you said, Dr. Vidot, we will be taking some audience questions. Okay, we'll start with the first one. Which areas of nursing do you see an increase of employment specifically for cannabis nurses?
Do you want to start, Dr. Williams?
I'm having audio issues, but saying I assume you asked this question. Can everyone hear me?
Yes.
We can hear you,
Okay.
yes.
So the areas of nursing that I see an increase in employment, specifically for cannabis nurses, based on our survey data, I can see a lot of nurses, due to the limitations of our federal legal requirements, they could go into entrepreneurial roles. A lot of the cannabis nurses we work with now have their own businesses where they provide education to their patients. So they have a lot of educational webinars and websites and personal consultations in medically legal states. So that's kind of a gray area in the law that they're able to provide these services. However, depending on how the law goes, I can definitely we're and behind the scenes, I'm a board member of the American Cannabis Nurses Association. So we've been fighting to work to, given this cannabis nursing is a specialty field now, to make this field a little less stigmatizing and normalized, given that we do have patient guidelines, we do have scope and standards, so that it is more normalized in traditional healthcare settings. So that's the goal.
I also
Great.
wanted to add to that we also have seen an increase in nurses that are becoming aware of coding for Python and AI type industries, and merging both of them together. And so that's actually one of the things that Dr. Williams and I are collaborating on as well, to educate and to help, so that we are not getting left in the sauce, left behind. So that's definitely, I've seen an increase in that, especially.
Well, can you talk a little bit about the whole AI, the AI that you're doing?
Yes, with pleasure. So as Dr. Williams was sharing earlier, some of that results, we didn't share all of it. And that was because of me, actually. And here I go already talking about AI. It's something that we have developing that we are working on. And so I can't share all the details. But in a general sense, what I can share is that this has become an opportunity to collaborate, especially for the younger generation that may be using cannabis as medicine, but still may be hesitant to communicate with providers, or maybe worried to lose their job, or for whatever reason that they're concerned about communicating. So we're thinking of ways to collaborate with agents, and I'll leave it at that for now. Maybe next time we can come share more about
that. To be continued. Very exciting. Thank you.
Yes.
Okay. So this is a question that we received from the audience. How do you become a cannabis nurse or get involved in the research?
All right, I'll take that one as well. So to become a cannabis nurse, as of now, as long as you're providing education and coaching and helping patients, you are also getting certified to learn about cannabis through continuing education credits. We do have several resources that you can obtain more educations and licensing, at least in the sense of getting a continuing education credits. We have the Society of Cannabis Clinicians. We also have some educational workshops provided by Cannabis Nurse Network. I'm also a board member of the American Cannabis Nurse Association. So if you also are considering joining that, please reach out to me. We have a lot of opportunities to get involved in education and research and just get you connected in a community of cannabis nurses. Even though we are deemed a specialty field, there are still limitations to get quote unquote licensed to do this stuff. But if you would like to be at the forefront of that, please get involved with any of these organizations. Also, we also have the Cannabis Nurses of Color, which I can connect you with as well. Oh, and you can also get connected with us. We have our QR code.
I was wondering when that was coming. Hello.
All right. Yes. Awesome. Thank you so much. All right. How is cannabis being used as a harm reduction strategy for people who are addicted to opioids and other drugs?
I can take that one. Or you can, if you want, Dr. Williams. I know your research is on that too.
All right. Well, please, Dr. Vidot.
Feel free to add to it. But one of the things that we're seeing firsthand in our research, especially with those who happen to be cancer patients or HIV patients, typically when you are undergoing treatment for cancer and you have the pain that comes along with it, opioids are one of the first things that are prescribed. And what we're learning is that for those who are consuming cannabis instead of the opioid or with the opioids, typically use less opioids. So for us, there's actually protocols that we're testing to see at what doses of cannabis and what type of cannabis, because not all cannabis is created equal. I can't believe I didn't say that a lot earlier, because it's so important to realize that cannabis is not cannabis, that's not cannabis. It's very important because each of us have that endocannabinoid system, and the components within cannabis fit in certain ways in the puzzle pieces of that system within our body. So when we're thinking about harm reduction strategy, one of the number one harm reduction strategies when we think about cannabis is know where you're getting it from, know the source, know what's inside of it, know the terpenes, because it's not always just about the cannabinoids that can actually help with the harm reduction for those who have a quote unquote addiction to opioids and other drugs. And I say quote unquote addiction because that word is heavily charged and I don't want to use it in a stigmatized way. So for those who have interest in reducing their opioid and other drug use, there is a place for cannabis to come in as a supportive mechanism to start reducing the other substance, and then eventually can be used to help with some of those pain management techniques or needs that are used with opioids to begin with. Thank you for that question. I clearly get very excited about that.
Well, thank you so much.
And may I add something?
Of course, I knew this was coming. Yes.
Yeah, and the research is very promising in this area. I know, Dr. Vidot, you have some data that shows that. But I will say, as an official harm reduction strategy, cannabis, there's not enough evidence to say that right now. And the reason why is out of our control at the moment, just due to federal challenges conducting research in this area. But hopefully when that happens, we can get more evidence to say that this is a proven and helpful treatment for those who use opioids.
Great point. Thank you for highlighting that.
Thank you. How can we amplify the voice of nursing in cannabis policy development?
Oh man. So I think right now, as I briefly mentioned, cannabis is still a very heavily stigmatized topic in nursing. Despite the ANA deeming cannabis nursing as a specialty field in 2023, we still have a long way to go. It's been 3 years, but um, we're what we do now is we work with community organizations that have been doing the policy development work for a long time. So again, the American Cannabis Nurses Association, they're in close communication with the American Nurses Association, which is like one of our governing bodies to advocate for cannabis policy development. But we also have some other organizations that you can work with. I think I mentioned Cannabis Nurses of Color. They do a lot of advocacy efforts in Washington, D.C. as well. Also, and just something that you can do right now, if you're a nurse and you're, maybe this presentation really piqued your appetite. I would also suggest getting this book. It's called Cannabis, the Handbook for Nurses by Carrie S. Clark. This book is great because it talks about some of the evidence of cannabis use and how nurses can play a role in advocating for their patients as well. So I would say for now, educate yourself, but definitely down the line, get involved with a group or community organization in your state or area. And again, how you can do that is through the American Cannabis Nurses Association. They'll be able to help you, or you can email me too.
Okay. Dr. Vidot, anything to add?
Oh, I always have something to add. Thank you. I also wanted to mention that it's very important to actually see what it's like to be on the Hill. There are, especially the societies for cannabis for clinicians, they go to the Hill. Minorities for medical marijuana goes to the Hill. So even if you're not speaking to senators or House of Representatives, to have that experience so that you can hear what the conversations are like. It was extremely transformational the first time that I spoke to a senator, and they literally told me to my face, that person said, I believe in cannabis as medicine because I use it, but we don't have enough research to make it policy. I was like, whoa, I almost screamed because I couldn't believe that came out. I never would have imagined that. So it's not always necessarily that the policymakers are not in favor of helping us have medicine as cannabis as medicine. But as Dr. Williams was saying before, is that sometimes that evidence is not there. So it's a little bit of a circle because they say the evidence is not there, but it's a little hard to do the evidence. So amplifying your voice by getting in the rooms where these conversations are happening.
Great advice. Thank you. Okay. What is the most surprising thing you learned from the data you collected?
Dr. Vidot, you can go first.
Trying to think there's so many surprising things. I'm going to start off with my very first study that I led, and that was my dissertation work. I did a study looking at cannabis and metabolic syndrome. And for those of you who may not know, metabolic syndrome is a cluster of 5 or more risk factors that lead to ultimately cardiovascular disease. And I'm very passionate about the brain, heart, and gut axis. And when I started doing that research, all the evidence was looking, and this was a study of over 8,000 participants. So it wasn't just a few, it was 8,000 across the US. And what I found is that those who were consuming cannabis had lower levels of fasting glucose, lower levels of insulin, lower levels of BMI, which is our body mass index, and lower levels of triglycerides. So this is very interesting because when I was doing that research, you always hear the joke or the stigma, which is our theme of the day, about cannabis giving you the munchies and cannabis consumers are lazy. Well, I can tell you with full confidence in the research that I've seen that that's not true for every cannabis consumer. And that was very surprising to me as a student because I was actually scared to publish that, quite frankly. It took me about 3 years to finally get it and hit send because every time I gave a talk about it, I would get attacked. Oh, does that mean cannabis makes you lose weight? Nowhere did I say that, sir or madam. I said that there's an association between cannabis use and a lower prevalence of metabolic syndrome. That was very surprising to me. And I just want to go quickly to wrap up that part of the story, that now I am collaborating with the NFL, NBA players, elite athletes that consume cannabis. And I can tell you that not all cannabis consumers have the munchies or are lazy. With a fact, I can tell you that. So thank you. That was surprising.
Dr. Williams?
Okay, thank you, Dr. Vidot. And I'll also add the work that we're doing now, honestly, is really surprising. The fact that cannabis and nurses are everywhere, working within their practice limitations, of course, but that they are in traditional healthcare facilities, that they're owning their own businesses and providing educational workshops, that they're navigating this field in the best way they can, and they've been doing it for a long time. But also, just thinking about the work that I'm doing under the NIH, just finding that a lot of people are using cannabis in the first place, people living with HIV. And this may not be due to medical reasons because there's certain barriers to getting your medical cannabis card. However, in my data, I'm finding that, as I mentioned, 80% of these people were using cannabis, and of those, 50% screened positively for cannabis use disorder. And I delved even deeper in that data, and I found that most of these people screened positively for depression and anxiety. So I want to dig deeper into this data, but it's kind of like an argument of what came first, the chicken or the egg, and did the anxiety come first, then they use cannabis, or did they? And some of my colleagues think, well, they have anxiety, they have depression and anxiety, so that's why they're compensating for, using cannabis. So just trying to understand that relationship a little bit more, and I'm really curious to see what I'd find, and it kind of mimics what's happening in the world right now, right? I'm not sure if you all have seen the news articles, but they're saying that cannabis use right now is outpacing even alcohol since 2022. So it's definitely a trend that's happening across the United States, and I just think we have a lot of work to do.
Yes,
We
so
do. We do.
even the definition of cannabis use disorder has a lot of work to do.
Yes.
For the
Thank you. Yeah, that's a lot. But yes, thank you. So true.
All right. So we'll take one more question. Last question. So, oops. Okay, there we go. Why did you create a task force instead of a community board?
Ooh, Dr. Vidot, go ahead.
Yes, I love that. The reason why is because the word community board has different connotations. And as I've been sharing throughout this talk so far, words are extremely important. And when we could have created a committee, we could have created, all of that. But to me, I wanted to give action-oriented power to this group. We wanted to give that. And we were thinking of the word, a task force was something that we felt would be taking action immediately. And just with the name itself, it kind of encourages us. We're not in a committee meeting. We are in a task force, and we have tasks to do with force. And I don't mean that literally. I'm joking here. But seriously, we did the task force because it's beyond just not to say just a community board, but this task force actually will eventually have multiple community boards within it, similar to how we operate within our global collaboratory. So that's a overarching reason why the task force. Words matter.
Great. So you mentioned that you were working on a survey / research. So can you talk about that for a second? Because we'd like to put the link up for our audience.
I'm having trouble hearing saying.
I can talk. She's talking about our survey, so I can move forward. So we are collaborating on this national survey that we were talking about before. She shared some of the results with that. So if you are a person who consumes cannabis as medicine, if you are a clinician, if you are anyone who's involved with the clinical care of anyone who could use cannabis as medicine, we encourage you to engage in our survey. And the purpose of the survey is for us to get an overarching lay of the land so that we can better understand needs assessments, so that we can go to the government or go to foundations or NIH to get funding to give resources to the communities within the survey that we find that need the most resources. So that's just a quick summary, and we are so grateful for participating in advance.
Yeah. Well, honestly, I really could speak to you both for another couple of hours. This has been so great, but unfortunately, we're going to have to end this very soon. But as we conclude, we'd like to remind you that the replay of today's session will be available on our YouTube channel immediately following the presentation. You can find Dr. Williams and Dr. Vidot's work and other resources in the chat. Please visit cannabis.ny.gov/research for more information about the cannabis research license. And take a moment to fill out the post-webinar survey so that we can make our webinars even better and better content in the future. And if you or anyone you know are interested in being one of our featured guests for this series, please complete the link to the form in the chat. Please stay tuned for the next Rooted in Research happening in March. And we want to thank you today for all that streamed with us and is watching us. And it's really been a privilege having Dr. Williams and Dr. Vidot share their insights and expertise with us today. So please stay curious, stay connected, and we will see you next time. Thank you. Have a great day.